Still figuring out this room. Do I know if I'm live right now or not? I am live. Okay, very good. All right. Well, good morning, everyone. Thanks for showing up this morning for our weekly Sioux Falls media briefing. Thanks also for coming at 11. We had some conflicts this morning, so I had to move it to 11. So thank you for that. This morning, I'm excited to announce our next public health director for the city of Sioux Falls. The gentleman to my right, Joe Kipley, who is not an unfamiliar name probably to many of you. For a variety of reasons, not only in his work world, but his public service role as well. Joe was chosen for this role for a lot of different reasons. His current health background obviously is a big part of why he's going to be a good fit. Joe's currently the clinic director at Sanford Clinic, the director of cardiology at Sanford Health. And having been a former healthcare executive myself, I know that that's a challenging role. Cardiology is a hard clinic to manage, a lot of different moving parts in cardiology, and so that background was very important. Also, his past experience with Imaginetics, spent a lot of years leading the Imaginetics work at Sanford Health. Managed the day-to-day operations of that across a variety of fields. Has worked with oncology, primary care, so just a really in-depth background in the healthcare space. Joe was very, very impressive to our hiring panel, our health department, and our Falls Community Health Board. All played a role in the interview process. It was a long interview process. I mean, we had a lot of interviews, 4 or 5, because there's a lot of different folks involved with this. And Falls Community Health is unique as they do have a board, and a board that really does have some operational oversight. And so making sure that our board was involved with Falls Community Health was very important as well. So in addition to his deep healthcare experience, also has a pretty good pedigree with higher education as well. Joe has a law degree, which is very, very helpful in a lot of the contracts and federal work that we do. In the health department, having a legal background and a law eye is going to be very, very beneficial to that. And then something that honestly I really appreciate is Joe's work in the public sector. He served as a county commissioner for a year and a half. And I think that's going to be a tremendous benefit for the city of Sioux Falls and also for our partnership with the county. So having someone who understands county operations, city operations jointly is going to be a real benefit to the taxpayers of the entire city as well as the entire county, I believe. He's also really involved in our community. He's a board member for the Boys and Girls Club. He's on the board of trustees for Bishop O'Gorman Catholic Schools Foundation. He's a Leadership Sioux Falls graduate in Rotary, and obviously his work as a commissioner is very important as well. So the way this works in the city of Sioux Falls is the mayor appoints directors for the departments, and then those require the advice and consent of the city council. So that will be presented to the council at next week's meeting on May 21st, and the council will vote on that and adoption. So with that, I'm very excited to introduce Joe today. Before I do that, I do want to just real briefly thank 2 ladies who served as our interim. Angie Youthy, who is here, and Amy Richardson, who is not here. She's still making the bacon over at Falls Community Health today. Those 2 people stepped up and served as the interim directors of Falls Community Health for the last several months while we did this search, but also while we worked through just a lot of operational efficiencies that we felt we could do and get some things in place before the next director started. So the great thing about the city of Sioux Falls is while we have directors over departments, it's really the people that are in the day-to-day and the operations of each department which really make things go. And so we were able to operate really efficiently under their leadership. So Angie, thank you. Amy, thank you for your role as interims as well. So with that, I'm going to turn it over to Joe just to give a few remarks, and then he'll open it up to any questions you may have for him in this role. Joe?
Thank you, Brandon. All right, a big thank you to the mayor. Honored to have this appointment and look forward to working with the city council to officially come into this role. Definitely want to thank the board of Falls Community Health and some other city officials. The mayor alluded to the interview process was very educational for me as well. I got to learn what the role was all about, and sometimes I think the public can have a misperception of what is healthcare in the community and what is the role of public health. So that, I think, is one of our missions in this role, is to help educate the community what healthcare opportunities and what public health means for the citizens of our community. And at its core, healthcare is about people. So definitely just feel proud to be part of the Sioux Falls community and now helping lead a portion of our city government. I grew up in Brookings, and Sioux Falls was kind of always this aspirational city. That's where the mall was, you know. So you always came down Interstate 29 to come visit Sioux Falls. And so to know that about 20 years later I would end up in city government and having a role with the county as well, and serving back to a community I feel like has given so much to me. But my public health journey came about 20 years ago when I was a Brookings High School student. I actually got the opportunity to go out to Washington, D.C. and be a Senate page for a semester. And so I served on the floor of the Senate, and my first day was September 4th, 2001. And so we all know what happened a week later, and the concept of terrorism took hold, and a lot of people remember the 9/11 events, but some people don't remember the public health events that came that October was with the anthrax attacks. And so this concept of bioterrorism and our readiness from a public safety, public health standpoint for man-made acts, so terrorist acts, or obviously we've learned a lot in the past few years about outbreaks and things with pandemics. So those things with public health started when I was a junior in high school, 16, 17 years old, and that planted a seed in me that I wanted to maybe go into some form of public policy, public health, and I had a couple internships during college with the State Department of Health out in Pierre. And so those were kind of those foundational experiences, but then I thought I wanted to become a lawyer. So I went to law school and kind of a recovering lawyer now, but I think that'll still be a good skill set to have in this role as well. But then just followed my wife's military career and had different healthcare opportunities along the way. And so when I learned about this public health role at the city, I kind of put it into three buckets, or is kind of how it was described to me, and it really clicked with three traits or 3 points of background that I have. So just the Falls Community Health and the clinical operations, that's probably the core aptitudes I have of just my clinic administration experience across different service lines, including primary care. Don't have any dental experience, so I'm looking forward to getting to know the dentists at Falls Community Health, but primary care, and then I've also been involved in oncology, cardiology, and genetics, so kind of across a different spectrum, and realize that it's a lot about those relationships, because our primary care patients at Falls Community Health will have to be referred out to some of those other service lines at Sanford and Avera and other community partners. So that bucket of just clinical operations, I feel like I've got a good handle on and can contribute value to that part of the organization. And then also the lawyer in me says we've got code enforcement duties, and so whether it's restaurant inspections or in-home daycare inspections, having been a compliance and risk management legal type officer at a hospital system in the past, knowing how to follow the rules and enforce rules and make sure our community is safe is another aspect. And then the final component is just probably the broadest definition, just public health, our community services. How do we raise awareness for different issues? With finite resources, how do we prioritize those issues? And so I think that's the one that's just most inspiring to me as far as the public service aspect of this, and being able to communicate out and build relationships. I don't think if we just thought we were Falls Community Health and we're going to be the best primary care clinic, that would be a good goal, but would it be great? Would it take the community to the next level? And I think to do that, you've got to partner with friends at Sanford, Avera, the VA, county, city, all across the spectrum with different partners. And so I think relationship building trust in our community, building trust across governmental entities, I think is one of the challenges of our time. So that's kind of my perspective on things, and just happy to work with the city council and answer any of their questions. And I think with that, I could answer any questions we have today.
John?
Yeah, are you familiar with a situation where a county, and I'm just trying to think this through, a county commissioner,
familiar with a situation where a county commissioner is then employed by the city in the same county. It seems unusual, but maybe I'm just...
I think it's fair to say I think it would be unusual, but I think that was actually my first phone call when I saw this job posting was to our state's attorney. So in my county role, talking through just the legal nature of different levels of government. And I think the basic answer is that at the local government level, a municipality and a county are essentially at the same level of government. One is not over the other or doesn't provide direct oversight over one another. So the advice I got was that that was going to be permissible. And then the other analogy I would give is anytime we have employees of big institutions in our community, so right now I've been a Sanford employee, and that inherently just creates various conflicts, and there's ways to deal with that. So the couple examples I could give you as a county commissioner and a Sanford employee was pretty much anything to do with our coroner's office, because that runs through Sanford. So when the Sanford contract came to the county commission, I recused myself on the appointment of a Sanford physician as the county coroner and the payment to Sanford for their medical services. So basically, if you just take things on a kind of case-by-case basis, if now my new day job and employer is the city of Sioux Falls, if we get presented at the county with a new contract to do some kind of services with the city, and that creates a conflict of interest where basically I'm on both sides of the contract negotiating with myself, then I can recuse at the county level.
And just to follow up, but there are times when when the county and the city maybe have an adversarial relationship. Would you agree with that?
There can be. I mean, yeah, any governments can have different issues. And so that's something we'll navigate too with, obviously my main focus here with the city will be the Department of Health. And I think those will be mainly synergistic relationships, things where we're on the same page trying to make things even better for our community members. So I think for the most part, the pros outweigh the cons, and what cons there are can be fixed through recusal or being walled off from certain projects within the city, and so walling me off on either the county or the city side as necessary.
What are your top priorities as the public health director?
Yeah, outstanding. So every 3 years, we do a new community health needs assessment or a community health assessment, and that kind of helps set our priorities. And so right now, we're due for that in 2025. So I think probably my biggest priority is working with community partners to find out what those priorities are. So it's almost maybe taking one step back from your question, but to give you a sense of what those priorities have been in this current cycle that we're in. The last assessment was in 2022. It's a lot of just kind of classic public health initiatives like active lifestyles. I know the mayor's already got me out for a 1 mile run with the, I'm falling a little bit behind on my 100 miles in 100 days, but definitely happy that we've got a good role model showing citizens in our community active living, but then also healthy eating, mental health, substance abuse. I think some of that we're seeing at the link being prioritized, different mental health and substance abuse issues. So how do we work on some of the things at the link? Another really big one that I think gets overlooked a lot is oral health. I mentioned the dentists at the Falls Community Health and the need to recruit more dentists and more dental hygienists to South Dakota. That's one of the things I think when we look strategically at what educational programs are in our communities in South Dakota. We don't have a dental school, so you've got to go all the way to Lincoln if you want to become a dentist. And so are those programs and things we can be working with our higher education, just other entities, back to those collaborations with education to focus on what are our career force of the future. I definitely know that from being at Sanford too, where we always need more nurses. We always need more medical professionals of all types. So I think the city can be a great promoter of that and making sure that our city is an attractive place. I've been involved in a lot of physician recruiting at Sanford, and you want to make sure that Sioux Falls, a lot of times people are trained on the West Coast or the East Coast, and they just think of Sioux Falls as flyover country. But how do we show them that this is a great destination for medical careers? So bringing people from the outside and also recruiting and retaining our own medical talent from within. So I think that might be outside the scope of Falls Community Health, but again, having a platform as a city official and being able to promote our community to medical professionals, I think will be one of the things I try to work on.
So what kind kind of personality characteristics do you think are going to be necessary for you to be successful with this job, having to build so much trust with so many people and negotiate a lot of things?
Yeah, outstanding. So I start from a position of humility in healthcare because I'm not a clinician, so I'm not a nurse and I'm not a physician. So I kind of start step one in every conversation, that knowing that the person that you're talking with in healthcare probably knows more about healthcare and providing care directly to patients. I've got a 6-year-old and 4-year-old girls, so when I work at a hospital, they think I'm a doctor. They're kind of at that level, so they think I'm a doctor, and I have to explain, no, I'm the person that helps the doctors at the cardiology clinic. So I think that's a great frame of reference for administrators in healthcare. Is you're one step removed. You help the people who help the people, if that makes sense. So you're kind of one degree of separation from the actual patient care, but all aspects, all people involved in healthcare are involved in patient care. Sometimes it's just more indirect. So that humility and then just relationship building, knowing that probably no one person in our community has the answers to solve the riddle of improving public health. It's going to take collaboration and community effort. So just building those relationships, obviously have a lot of relationships at Sanford already, have some relationships at Avera and looking forward to building those. My wife's military background, very proud that we have a great VA facility in our community. So we kind of have it's just a series of blessings here in our community that we have to be thankful for, but we can't take them for granted either. And we want to keep building up those private sector partners as well.
You talked about educating people about public health. What exactly is public health, and what exactly is your role as the director of this department?
So yeah, there's going to be a lot of different definitions of public health. So you could define it as narrowly or broadly as you would. But I think it's just kind of that sense of the physical and mental well-being of a community at a macro level. But then obviously on an individual per person basis, there's all sorts of metrics of your clinical health. And part of that, I think, is making sure you have a relationship with a primary care provider. I think a lot of people try to get by on their own and are struggling mentally and physically, and access to care is, I think, our main mission here on that clinical side of just giving people an opportunity to have a relationship with a primary care provider. That's a very sacred relationship. As an attorney, we talk about attorney-client privilege a lot. Well, that relationship with your primary care physician is like that too, being able to entrust them with information and build that relationship. So that's kind of that micro level of public health. Do you have access to a primary care provider? Can you at least get your foot in the door to basic care? But then on the macro level, you're thinking about public health initiatives like vaccinations, and are we healthy as a community? Are we able to ward off illnesses, and is our water safe? Are our restaurants safe? Inspections and just enforcing the codes that the mayor and the city council pass as ordinances, and having kind of the rule of law play with public health. But yeah, so hopefully that was responsive to your question. But yeah, it can mean a lot of different things to a lot of different people, and I am not an epidemiologist or a physician or a nurse, but I think I bring a set of skills alongside those types of people that will put us in the right direction.
You mentioned the substance abuse component, and obviously there's a lot of things that connect with that, including crime. A lot of crime happens because of that, and there are a lot of repeat offenders because of that. So having been in this city a long time, working in a lot of different facets, how do you kind of navigate that puzzle, and what's best to handle that component?
Yeah, and again, I would come back to there's probably no single person that can crack that nut. I think that's going to take collaborations and whatnot, but that's something I probably see even more at the county level with the judicial system and our county courthouse, and then building relationships with state court judges, what they see. Different paths for some of those people for diversionary courts or special courts, drug court, DUI court. Different things like that trying to get people on the right track so they don't repeat, basically aligning incentives so that they don't reoffend. So those are some of the classic things we'd be thinking about more on the criminal justice side. Still learning some things at the city level, but I'm really heartened to know that some of my key partners here at the city, in addition to the mayor, will be the fire chief and the police chief, and knowing that public safety and public health go hand in hand. So we can be working together and be sharing information with one another. What are we seeing in the community? What are members of our departments seeing in the community? Are there patterns? I think that's a big thing from like an epidemiology and disease standpoint. You're looking for those early indicators of things in your community before they spread and become a endemic to the community. Crime can be an example of that. But yeah, so public safety and public health definitely have a nexus, and it's going to still come down to collaborations and partnerships.
I'd like to actually say something on that, because he hit on something that's important in his role, and I'll kind of lift the curtain a little bit on how we run the city. I have regular meetings with all my directors, but I lump them together because I have 12, 13 direct reports, and it's just not feasible to have one-on-ones with all of them. So the police chief, the fire chief, and the public health director, we meet every month together, the three of us. Planning and engineering, they meet together. Parks and library, I have meetings with them together because you can see the overlap. So we see the natural intersection between public safety and public health for the reasons you just stated. So it's very important when we're in those meetings for them to share what they're seeing from a crime and public safety perspective, and how maybe some public health things that we maybe need to address could help tackle that. So there's a lot of intersection, to your exact point, between those folks, and that's why we actually combine them together with director meetings every month. So.
From a public health perspective, we're kind of looking at the rearview mirror of what might have been the worst generational crisis with the COVID incident. I mean, would you have supported mask mandates, vaccine mandates, lockdowns, those kinds of things?
You're really going to do that? Come on.
I mean, come on.
No, I know. I'll let him speak to that. So, yeah.
Well, I think the city and the state of South Dakota did a great job. I think there were a lot of unknowns, and I think that's one of the things to keep in mind when you're in emergency management situations, public safety. It's hard with the benefit of the rearview mirror to second guess people, but I think going forward, I think there are some lessons to be learned from those things. I think there's aspects of kind of after action reports. I think one of the challenges I've highlighted is trust in institutions. Sometimes there are mixed messages coming from our government institutions during that time period, and part of it was because there was just so much unknown. So not blaming those institutions, but trying to lift them back up and say, we need to have trust in our, CDC and State Department of Health, city, public health. We've got to build those up and build credibility back. So those are going to be some of the challenges, but we've obviously learned some lessons from that pandemic, and we're not wishing a repeat of it anytime soon, but I hope we could respond well and our community would rally to what's in the best interest of public health at that time and public safety.
What would you say some of those lessons were?
Well, I guess I wouldn't hold myself out as a scientific expert in there, but I think one of the biggest things, and this is maybe just a general lesson on public policy, there's trade-offs. There isn't one right answer, and we all just need to do this, and it will magically be solved. Pretty much everything in public policy is some form of trade-offs. We have finite resources. We'll be talking with the mayor's table about budgets and whatnot, and I'm sure I'll be advocating for more money for public health. But, then that cuts from somewhere else potentially. So you have to understand that when you're advocating for something, usually in a world of finite goods, then you're taking away from something else. So usually public policy questions, I ask questions like, what are the trade-offs and compared to what? We're trying to maybe have better, more healthy lifestyles in our community. Well, compared to what? What are they now? How do we get there? How do we still allow for obviously individual liberty and freedom? We're not making people participate in these various activities. We're just trying to show them information and resources that they can go about. And I know that was one of the challenges during the pandemic, was just different trade-offs against public health guidance and individual liberty bouncing up against each other. So those are challenging questions, and it's a little bit easier to judge in hindsight. But definitely, I think any after-action report of an emergency event is a learning exercise and a learning event. So many lessons to learn.
All right. Thank you all so much for coming this morning. We appreciate it.
Awesome.